How to recognize and respond to a heart attack, a guide to saving lives. A heart attack is a medical emergency that can strike without warning, bringing with it a wave of fear and confusion. It occurs when the blood supply to part of the heart is suddenly blocked, often due to a blood clot. This blockage prevents oxygen from reaching the heart muscle, causing damage that can be fatal if not treated immediately. Understanding the signs and knowing how to respond can make all the difference in such a critical situation. Recognizing the signs of a heart attack. A heart attack can manifest in a variety of symptoms, some of which may seem subtle while others are more obvious. The most common sign is a crushing pain in the center of the chest. This pain often spreads to the jaw and down one or both arms. However, chest pain isn't the only symptom. Here are other key indicators. Breathlessness. The person may struggle to breathe or gasp for air. Sweating. They might start sweating profusely, even if they're not exerting themselves. Indigestion-like pain. Some people experience pain that feels like severe indigestion. Dizziness and collapse. A sudden feeling of dizziness or lightheadedness can occur, sometimes leading to a complete collapse. Pale skin and blue lips. The person's skin may become pale, and their lips may take on a blue tinge, indicating a lack of oxygen. Rapid, weak, or irregular pulse. The heart may beat faster or more irregularly than normal. Feeling of impending doom. It's not uncommon for the person to have an overwhelming sense that something is terribly wrong. These symptoms can vary in intensity and may not all be present at once. However, if you notice any combination of these signs, it's crucial to take immediate action. What to do during a heart attack. Time is of the essence when dealing with a heart attack. Here's a step-by-step guide on what to do. 1. Call emergency services immediately. Dial your local emergency number and clearly state that someone is having a heart attack. The faster medical professionals arrive, the better the chances of survival. 2. Help the person into a comfortable position. Ideally, they should be seated on the floor with their knees bent, and their head and shoulders supported. This position reduces the strain on the heart. You can place cushions behind their back or under their knees to make them more comfortable. 3. Administer aspirin. If the person is not allergic to aspirin and is over 16 years old, give them a 300 mg aspirin tablet to chew slowly. Aspirin helps by thinning the blood and can reduce the severity of the attack. 4. Use angina medication. If the person has angina and carries their own medication, such as nitroglycerin, help them take it. This can help ease the symptoms while waiting for emergency services. 5. Monitor the person closely. Keep a close watch on their condition. If they collapse or become unresponsive, be prepared to start CPR, cardiopulmonary resuscitation. How to perform CPR. If the person stops breathing or loses consciousness, CPR can be a lifesaver. Here's how to do it. Start chest compressions. Ensure the person is lying on a firm surface. If they are on a bed, and it's safe to do so, move them to the floor. Kneel beside them and place the heel of one hand on the center of their chest. Place your other hand on top, interlocking your fingers. Keep your arms straight and lean over the person, pressing down hard, about 5 to 6 centimeters, on their chest, then release to allow the chest to rise. Aim for a rate of 100 to 120 compressions per minute. Provide rescue breaths, if trained. After 30 compressions, tilt their head back slightly, lift their chin, and pinch their nose shut. Take a deep breath, seal your mouth over theirs, and blow into their mouth until you see the chest rise. Give 2 rescue breaths, then return to chest compressions. Continue this 30-to-2 ratio cycle until help arrives. If rescue breaths are not possible or you're not comfortable performing them, stick to continuous chest compressions. Final thoughts. A heart attack is a frightening experience, but quick and decisive action can save lives. By recognizing the signs and knowing how to respond, you can be the difference between life and death for someone in need. Always remember, when in doubt, call for help and start CPR if necessary. Your actions can truly make a life-saving difference. Thanks for watching. Come along with me to the next journey. Till then, please subscribe to the past and present and click the bell icon to get notified about our upcoming videos.